we do know that this organism is not an airborne organism, meaning if you are in a room where somebody has the infection, you're not going to acquire it. This is part of the recommendation why we're asking people to have social distancing of being at least 4 to 6 feet away, because it's spread through droplets. So you'll cough or you'll have a droplet, it's very heavy, it'll drop to the ground and it won't make it to somebody's face. And so we have face shields that are set up at the assessment center when they first arrive. If somebody is positive on a screen with either fever or dry cough or shortness of breath, they'll be asked to put a mask on, which is one way to prevent the droplets from spreading. And our frontline staff will also be wearing masks. So if a patient's coming into our assessment center on Monday, don't be alarmed if you see the frontline workers with masks and gloves and gowns if necessary. If you come here and you don't meet criteria and you have no symptoms, you are not going to be tested, and that flow through will be very quick. You'll be given that information, you'll be provided with further information, and then you're going to be able to go home. The other possibility is you come in, you have symptoms, and you may not meet the case definition criteria to be tested, but we'll still get a medical assessment by a professional, have investigations if you need it, and then again, whether you're sick enough to be admitted to hospital or be able to be discharged home, that decision will be made. And then the third outcome that could happen is you actually meet the case definition criteria, you will be tested, and then while we wait for the test, it depends on, again, whether you're sick enough to be admitted or you could go home and self-isolate. We are encouraging people to contact either their primary care provider, Public Health Ontario, or our local health unit before coming here. But we're not going to be turning away people who show up at the door. We know there's going to be a backlog. We know there's trouble getting into certain lines. Patients might even have trouble contacting their family doctor to get advice on when to come in. So we're not going to turn them away, but you're right, if they have no symptoms and no travel history, this is not the place for you. You will be using up resources that are very valuable while we try to assess patients who are sick or have symptoms.